Welcome. It's David Wiss with the Los Angeles District. That's LAD, California Dietetic Association. We've been discussing research because it's so important. It forms guidelines and makes recommendations for practice. Therefore, it's very important to have protocols in place when doing research to minimize bias. We're going to talk about sampling. Sample selection and the sample size are both two factors which are critical for minimizing study bias. The sampling methods should utilize some random techniques if you plan to apply the findings to the general population. A basic example would be examining the role of the registered dietitian at California universities. You may not be able to look at every single one, but perhaps you could randomly select 50 and examine their scope of practice. In random selection, everyone has an equal chance of being selected. Sometimes you can't use random selection, for example, when you're doing a survey study, and you have to settle for whatever subjects you can find. This is known as convenience sampling. It does pose threats to external validity, and we're going to discuss that in a future segment. Always estimate your sample size beforehand. There should be exclusion and inclusion criteria. This will help you have a very clearly defined study sample. If your size is too small, for example, less than 100 or less than 50, it could lead to type 2 error, which says that there are no associations or relationships when there actually is one. Having this type of lack of statistical power can actually contribute to further confusion on a research topic. This is all related to internal validity, and we're going to talk about that in the next segment. Now, randomization should occur for sampling methods and for the groups in which you might intervene on, if it's an intervention study. Groups are randomly separated, and this occurs by chance. The differences in the groups should be distributed evenly, theoretically. So, for example, differences in age, income, gender will be randomly distributed across the different groups, and this will minimize differences in what we call confounding variables. There's official techniques for randomization, for example with a computer, but in the old days they may have picked from a hat or rolled a dice. The gold standard is a randomized controlled trial. That means that groups are separated randomly, and there's a control group and there's an intervention group, which is the trial. It's prospective. Oftentimes subjects are blinded to what group they're in. This is difficult with food because subjects know if they're, for example, eating a blueberry or not. So a lot of times research with food is done with supplements rather than the food. This also minimizes the confounders of other potential elements in the food that can contribute to the findings. A randomized controlled trial establishes cause and effect, but it's not always possible. If you can't control all elements of the study, there are some statistical strategies that can adjust for some of the confounders, such as demographics, and this could be done with a software program. Sometimes it's not practical to randomize. For example, if you're going to do an exercise intervention on patients with type 2 diabetes at 2 different sites, you might do the intervention at one site and not the other. This isn't randomization, this is a non-randomized trial, also known as quasi-experimental design. This will establish an association, but not a cause and effect. Other times it's not ethical. For example, if you had a pregnant woman with gestational diabetes, to randomly select her into the control group to receive no intervention with diabetes management may pose some ethical challenges. See, the findings of a study can be compromised if these details are not managed and optimized. So in the next segment, we're going to talk about internal-external validity and discuss some of the threats. If you have any questions about this stuff, you can leave a comment below. We'll certainly answer it for you. Stay tuned. There's so much exciting stuff coming your way from LAD this year. That's David Wiss, and I'm signing out.